Hi, my name is Darrell Rogers. I am the family recovery coach. I work with the parents of children who are addicted to drugs or alcohol, and I'm here to help you get your hope back. Today I'm going to talk about the 6 C's for the parents of drug addicted children. The first C, number 1, is you didn't cause it. And here's what I mean when I say you didn't cause it. As loving parents, we all make the best decisions for our children that we can with the information that we have at the time. If you happen to remember some parenting mistakes that you made in the past, focusing on those now will not help you move forward in a positive direction. In fact, it can hinder your relationship with your addicted child, and it can actually contribute to the problem. What happens when parents begin to obsess over parenting mistakes that they may have made is that they get caught up in guilt and shame and self-blame. And those things lead parents, more often than not, to fall into enabling behaviors. So if they have some guilt over some things that may have happened when their child was growing up, or some parenting mistakes that they think they made, parents may end up trying to make up for that by what I call unhealthy helping or enabling. So in other words, you end up doing things for your child that they could be and should be doing for themselves by trying to fix the problem yourself. As adults, we all have to accept responsibility for our own choices. And as you learn to let go of what happened in the past, you can move past some of those enabling behaviors that might be keeping you and your child stuck where you are. The second C is control, and these two kind of go together. You really have no control over anyone other than yourself. And the more effort you exert towards trying to control your addicted child, usually the more resistance you will meet. Your addicted child may behave like they're much younger than their biological age, and that's really common. So parents tend to naturally try to protect and rescue their adult child who is making these childish choices and decisions. Part of the problem with that is that your adult child, even though they're behaving like they're much younger than they actually are, they will resent you treating them like a child. They want to be treated like an adult. So as their parent, you really need to treat them like an adult. Now that gets very difficult because I know that sometimes they're making choices that could be harmful to them, and you get caught up in some of the consequences of their choices. But ultimately, you have to learn to let go of control, of trying to control them, because number one, you don't have any control over them, and number two, the more you try to control them, the worse, the more tense the relationship tends to get, and it's not good for you either. It can be very harmful to you in terms of creating a lot of stress because you're constantly running around trying to put out fires, trying to fix or correct their behavior, or trying to help them avoid the consequences. The third C is cure. You can't cure their addiction. So here's the thing, even treatment is not a cure. A lot of people mistakenly think that treatment, if they can just get their child into a really good treatment program, that they'll be cured of addiction. There is no cure, unfortunately. Having said that, I would still recommend that every child that is struggling with a substance use disorder go to treatment. But parents have to get this notion out of their heads that there is a cure for addiction, or that they can cure their child's addiction. Your child's recovery, long-term recovery, is going to be something that they're going to have to find within themselves the strength to do and the desire to want to achieve. But you can contribute to the process if you make some of the right choices, which brings me to the fourth C, which is contribute. You can contribute to the problem or you can contribute to the solution. The choice is really yours. So how do you switch from contributing to the problem to contributing to the solution? First of all, you begin to dive into learning more about addiction. Read every book that you can find on addiction. Educate yourself on addiction. Join a peer support group where you can meet with other parents who are going through the same thing. Learn how to let go of control a little bit more and learn how to reduce your worry and your enabling behaviors. And while you're at it, dive into your own personal and spiritual growth, because you don't have any control over your child. So you need to focus on the one person that you can control in this equation, and that is yourself. And the more you do that, the more you dive into controlling yourself and growing spiritually and personally, the more resilient you become, the more you can handle that emotional roller coaster, and the more you can let go of control over your child, because some of that fear goes away of what may happen. You get the fear under control, and all of that will result in a better relationship with your child, which can in turn lead to them. You can have more influence over them. So you want to shift from having control, or from trying to have control, over to trying to be a positive influence. But the way that you become a positive influence is really not to try to be an influence, but just to let that be a natural byproduct of your own growth. And I know it sounds a little bit demeaning, like, oh, well, you don't think I'm mature enough, or I need to grow. Well, we all need to grow. I'm 60 years old. I'm still growing spiritually and personally every day. I'm getting stronger, and it's not a straight line up. Sometimes there are setbacks, but hopefully over time it's a gradual improvement. But it does require effort. You don't just grow organically without any effort. It's not like a plant like a weed. What's interesting is that in your garden, weeds, you don't have to put any effort towards the weeds coming up, right? But if you want to grow some vegetables, you have to cultivate the soil and fertilize, and you have to pull the weeds. You have to water, make sure the plant gets enough water. So it's the same sort of thing with your spiritual growth. And as you grow stronger internally, again, you worry less, you become less controlling, and a byproduct of all of that, there's no guarantees, okay? There's no guarantees, because your child is their own person and they can do whatever they want. When it comes to someone with a substance use disorder, the learning curve can be very steep, unfortunately, especially with some of the drugs that are out there today. But you don't have any control, so dive into what you can control. And as you do that, you give your child their best opportunity at recovery. So that brings me to the fifth C, which is communication. And this is part of the way that you can contribute to the solution, is becoming a better communicator. And I could make another whole video just on communication skills alone. In fact, I could probably make several on it. It's a very deep subject. Start off with the basics. Become a better listener, an active listener. It starts off with some very simple things. We all have the tendency that when someone else is talking, and particularly when we know that we have a little bit of a disagreement, we see things a little bit differently, we want to get our ideas across to the other person. And we tend to, when they're talking, we're not really listening to what they're saying. Instead, we're forming our own thoughts on what our rebuttal is going to be, what we're going to come back with. So I would encourage you to try to make a habit of making eye contact with your child. And then these communication skills can apply to all relationships. Now, business relationships, other family relationships, friends. It will help you with everything in life. And so it's a good thing to work on. And it does take practice, but the first step is becoming aware of the situation. So first thing to work on is your listening skills, and that is start out with leaning into the speaker a little bit. When you lean in, that's body language that lets the speaker know that you're interested in what they're saying. So don't overdo it, just lean in just a little bit. Make eye contact. Don't stare at their eyes. Let your eyes go around to different points on their face, like their nose, their chin, their mouth, back up to their eyes, their forehead, back to their eyes. You don't want your eyes all over the place. You do want some eye contact for a few seconds, before you look around. You just don't want to stare. That becomes a little bit awkward. But you do want good eye contact. That is another sign that you're really listening to the speaker, or in this case, to your child who has the drug or alcohol problem. So lean in a little bit, make eye contact, and here's a really good tip when it comes to communication skills. Validation. A lot of times we tend to think when someone is complaining to us that they want us to provide a solution. So we're working on the solution, when a lot of times all they want is to be heard. They want someone to hear what they're saying. They need to vent. So instead of trying to provide a solution, which could offend them when you try to provide a solution, instead of that, use a validating statement that goes something like this. What I think I heard you say was, and then you fill in the blanks. Is that right? That lets them know that you heard what they were saying, or if you didn't get it exactly right, gives them a chance to explain it in better detail. And it lets them know that you care about what they're saying. So these are just some basic tips, some basic communication skills that can enhance your communications with your child. One more, I've got to throw one more in here. And again, this is another video altogether, but I've got to throw one more in here. Facial expressions and body language. You want to be aware of that. And here's the thing, usually whatever you're thinking will come through in your facial expressions, even in your voice. Sometimes if you're scared, your voice can get a little quivery. If you're angry, your eyebrows are furrowed. If you're closed off to what they're saying, your arms are crossed. And there's a lot of other little cues with facial expressions, and a lot of times we don't even realize that we're doing it. So the best way is to realize, to be aware of what's going on in your mind. If you're thinking negative thoughts about something, it's probably going to subconsciously come through with your facial expressions. So you have to try to control your thoughts a little bit so that your body language and your facial expressions don't tell on you and tell your addicted child that you're displeased with what they're saying, because it's fine to be displeased, but they're going to feel like you're not really listening to them, and that you've already made up your mind if they pick up on those nonverbal cues. So that's one thing to think about a little bit. And I don't want you to overthink it so that you're so focused on that you're not focused on the conversation. But as that little seed is planted in the back of your mind and you're reminded of it from time to time, it will change the way you communicate over time. You will naturally become a better communicator and more aware, more self-aware, more aware of your communication habits and bad habits. So that brings me to the 6th C, which is change. You can change. We all have the ability within us to change. It takes effort, and sometimes it takes some divine intervention. In fact, that would be my go-to, because sometimes we don't seem to have the power within ourselves to make those real deep down changes that we need to make. Sometimes we have to kind of look at the ugly truth of what causes us to behave and think the way that we do, and we have to be willing to let God fix those things in us. But I do want to encourage you that you can change. Change is possible, and it is the only thing, going back to control, it is the only thing that you have any control over, is making the decision to change yourself or not. You don't have any control over anyone else in this situation. You don't really have any control over anyone else, period, but particularly when it comes to dealing with your child who is addicted to drugs or alcohol, you cannot control them. You can only control yourself. So work on that. Focus on controlling you. Focus on changing you. You can change. Put forth the effort. Watch more of these videos and just begin working on yourself. All of that worry, all of that fear, all of those negative emotions, take those negative emotions and repurpose them, rechannel them. Take all of that negative energy and focus it towards growing personally, getting stronger, changing yourself. My name's Daryl Rogers. I am the Family Recovery Coach, and I'm here to help you get your hope back.